Mental health refers to our cognitive and emotional well-being. It's all about how we think, feel, and behave. Stigma is a very real problem for people who have a mental illness. Based on the stereotype, stigma is a negative judgment based on a personal trait, in this case, having a mental health condition. It was once a common perception that having a mental illness was due to some kind of personal weakness. We now know that mental health disorders have a biological basis and can be treated like any other health condition. Even so, we still have a long way to go to overcome the many misconceptions, fears, and biases people have about mental health, and the stigma these attitudes create. Stigma placed on the mentally ill dates back to 400 BC. The Greek physician Hippocrates treated mental disorders as diseases understood in terms of disturbed psychology and evidence of demonic possession. This idea was also supported by Egyptian, Indian, Greek, and Roman writers. Medieval Europeans allowed the mentally ill their freedom as long as they were not dangerous. Though as time went on, Europeans increasingly began to isolate the mentally ill, often housing them with handicapped people, vagrants, and delinquents. Those considered insane were increasingly treated inhumanely, often chained to walls and kept in dungeons. After the French Revolution, moral treatment of the mentally ill grew in popularity. French physician Philippe Pinel took over many insane asylums and forbid the use of chains and shackles. He removed patients from dungeons and provided them with sunny rooms, and also allowed them to exercise on the grounds, though in other places mistreatment continued. U.S. performer Dorothea Dix observed the mentally ill in Massachusetts, both men and women of all ages, who were incarcerated like criminals and left unclothed and in the darkness, without heat or bathrooms. Over the next 40 years, Dorothea Dix lobbied for the mentally ill and established 32 state hospitals. In present day, many seriously mentally ill people have been removed from institutions. This is due to antipsychotic drugs, which allow many psychotic patients to live more successfully and independently. Once discharged, they are directed towards local mental health homes and facilities. However, many people suffering from mental illness become homeless because of inadequate housing and follow-up care. Due to this, many patients return to inpatient facilities such as Moses Taylor's Senior Mental Health Unit, where I volunteered. Moses Taylor Hospital is a community-based health care facility with a long tradition of providing quality health care services to the residents of northeastern Pennsylvania. It was founded in 1892 by a New York City merchant, banker, and industrialist named Moses Taylor. The mission of the hospital was to care for the coal miners of the region. The main campus of the hospital remains at its original site at 700 Quincy Avenue, Scranton, Pennsylvania. Moses Taylor's Senior Medical Mental Health Unit is designed specifically for older adults experiencing psychiatric symptoms requiring acute 24-hour inpatient care. The unit consists of 22 beds where patients receive both medical and psychiatric care tailored to their individual needs. A full range of individual, group, and family therapies are encouraged as a part of their treatment plan. Family education is also provided. Moses Taylor Hospital's Senior Medical Mental Health Unit strives to return patients to their pre-hospital environment, but when that is not possible, families can assist in choosing alternative placement. My first day at Moses Taylor's Senior Mental Health Unit, I was nervous. I was afraid I would say the wrong thing, or do the wrong thing, or worse, forget all that I had learned. But despite my fears, I pushed the button and opened the doors. In the morning, I would attend team meetings where psychiatrists, psychiatric nurses, social workers, and occupational therapists would meet to discuss the various cases in regard to patient progress, medication change, referrals, and discharge. As I listened, I heard more than the medical terminology. I heard a presence of burnout in the form of sarcasm and inappropriate comments. The psychiatrist would make comments such as, "Ah, he's here again, probably just looking for a free meal," or even, "He's crazy." I couldn't believe what I was hearing. I wondered if this could happen to me one day. Would I be burned out and void of all compassion? Then it suddenly occurred to me, is this where the stigma originates, in a room of so-called professionals? After the team meetings, I would co-facilitate groups with the supervising occupational therapist, Maria Emma. In group, I got to know who the patients really were, what they liked, what they disliked, what made them happy, and what made them sad. They became more than just names on a chart. They became living, breathing people. They would tell me stories. Some were heartbreaking, some were funny, and some were just amazing. One in particular made me cry. An elderly woman admitted for major depression told me about the love of her life, her husband. They met during World War II. He was a naval officer and she was a nurse. They wrote letters back and forth for months. When his letters suddenly stopped, she waited, hoping and praying that she would hear from him. But she didn't. Eventually, even though it broke her heart, she moved on, married, and had children. Then one day, at the market, she felt a tap on her shoulder. She turned around and it was him. They talked for hours. He told her he had been a POW, and by the time he returned, she was already engaged. They remained friends for years. When her husband was diagnosed with cancer, he supported her. When her husband died, he held her hand. And when she wanted to spend the rest of her life with him, he proposed. They were married for 30 years, but now that he was gone, she felt lost. Hearing her story made me realize that people with mental health have real pain. It's not fake. It's not something they just make up. So why is there still a stigma associated with mental illness? As I watched the occupational therapist sit down next to the woman and hold her hand and tell her, I know your pain is real, but I am here for you. You're not alone. I concluded that the stigma doesn't originate primarily with mental health professionals. I think that it comes from the misconceptions held by our society as a whole, or just the fact that most people don't want to understand why an 80-year-old woman is depressed. I think in order for things to get better, we have to start caring. We have to want to know the story behind the diagnosis. My mother is one such person. She adopted my brother Matthew, who is autistic. As a pediatric nurse, my mother has always wanted to help children in need. When she saw Matthew, she saw a little boy who wanted to fight, who wanted to be more than society thought he could be. Her greatest challenge as mother of a mentally ill child is to watch how people treat Matthew. People stare and make rude comments and look at Matthew as though he has some sort of disease. Her greatest joy is seeing Matthew smile and just enjoying life. Her advice to someone considering adopting a child with a mental illness is to understand what you are taking on. It's a big responsibility. You're their entire world. You're their voice. This is my experience with mental health. I believe there is hope for the future. I believe there is hope if people are willing to hear the story behind the diagnosis.